While COVID rages on in Montana, healthcare workers continue going to work in person, meeting with patients and trying to get our communities back on their feet. KPAX's Megan Mannering spoke with a physician in Missoula who says at this stage of the pandemic, challenges like quarantine are making her job even harder.
8 months since the first COVID case was reported in Montana. By now, the COVID fatigue has set in for most of us. We do everything we can to take our minds off of the virus that's uprooted our lives. But for one industry, ignoring the pandemic isn't an option.
It's the multiple day in and day out, looking down the hallway, seeing the nurses and people who normally don't work in clinical areas pitching in and helping out and donning their PPE and going into these rooms and taking care of people.
Angela Palesi is a general surgeon for Community Medical Center. Infectious disease may not be her area of expertise, but COVID, as we've learned, knows no boundaries.
People with COVID still get appendicitis and still get cholecystitis and bowel obstructions and other normal health problems. And so that's where I've been taking care of COVID patients.
Her day-to-day responsibilities as a surgeon, with another layer of stress due to COVID care, are only made harder when her colleagues are forced into quarantine. Right now, 39 staff members fall into that category.
Capacity to us at this time really is more of a patient to staff relationship.
The hospital has brought in backup. Facilitated by a local travel agency, they now have additional staff here from out of state. Dr. Palesi says that doesn't make it any easier for those quarantining.
It can be very distressing when you know that your colleagues are at work. When you have to quarantine at home and everyone's here working hard, it can be difficult for you, but it's important that we keep each other safe.
Dr. Palesi is one of the hundreds who work at Community Medical Center. Each person faces challenges like hers day in and day out. For that, she says it's hard to see those in the community who don't take the pandemic seriously.
Absolutely frustrating. You know, it's simple and it's not a major life change to be wearing a mask. It is a major life change to be staying away from friends and loved ones, and I totally understand that. But it's crucial that even if you know that you're somebody who may or may not get very ill, or you don't care about yourself as much getting ill, it is important that you're protecting the community at large and of course your loved ones, because you may be spreading the virus before you even know you're sick.
In Missoula, Megan Mannering, MTN News.
Community Medical Center says one easy but helpful way that you can get Montana's numbers down is to avoid those high-risk situations, whether it's a crowded bar or even a large family gathering.